Hey everyone, NutriMama here. Today, let's talk about home pregnancy tests. Those little sticks that can change your life in minutes. They're convenient and claim over 99% accuracy, but only when used perfectly. Even then, they're not foolproof. False positives happen, and they can be an emotional roller coaster. Seeing a second line when you're not actually pregnant is confusing and distressing. Why does it happen? What does it mean for your health? Let's break down 7 reasons you might get a false positive, and what to do next. Let's dive in. When it comes to pregnancy tests, the most common culprit behind confusing or inaccurate results is surprisingly simple: user error. Even though these tests are designed to be straightforward, small mistakes in how you use them can make a big difference in what you see. Many people don't realize just how easy it is to misinterpret the results or miss a crucial step in the process. One of the first things to check is the expiration date. Expired tests lose their accuracy. Always check the date before you open the box. Using a test that's past its prime can lead to false negatives or positives, making an already stressful situation even more confusing. It's a simple step, but it's often overlooked in the rush of the moment. For the most reliable results, use your first morning urine. This is when the concentration of HCG, the hormone detected by pregnancy tests, is at its highest. Overnight, your body has had time to build up this hormone, making it easier for the test to pick up even small amounts. Skipping this step can sometimes mean the difference between a clear answer and a faint, confusing line. If you test later in the day or after drinking a lot of fluids, your urine can become diluted. This dilution can lower the concentration of HCG, making it harder for the test to detect a pregnancy, especially in the early days. So, try to avoid drinking excessive amounts of water before testing and stick to that first morning sample whenever possible. Timing is everything. Each test comes with a specific window, usually a few minutes, when you should read the result. If you check too early, the test might not have had enough time to react. If you wait too long, you risk seeing an evaporation line, which can look like a faint positive but isn't a true result. Always set a timer and follow the instructions closely. Evaporation lines are a common source of confusion. These lines are colorless and appear after the recommended reading window. They can easily be mistaken for a positive result, especially if you're anxiously checking the test over and over. Real positives, on the other hand, have color and show up within the time frame listed in the instructions. Sometimes the test itself is the problem. Faulty tests can happen due to damage, improper storage, or even rare manufacturing errors. If your test looks damaged, has missing parts, or the control line doesn't appear, don't trust the result. It's frustrating, but it's better to be safe and try again with a new test. If you're ever unsure about your result, don't hesitate to retest. Use a new kit from a different box, or even try a different brand for extra reassurance. Sometimes a fresh test is all it takes to clear up any doubts and give you peace of mind. The bottom line? Follow the instructions exactly as written. Check the expiration date, use your first morning urine, and read the results within the recommended time window. These simple steps can make all the difference in getting an accurate answer. It might seem like a lot to remember for such a simple test, but taking these precautions is the best way to avoid unnecessary confusion and stress. A little extra care now can save you from a lot of worry later. Don't let a simple mistake send you on an emotional roller coaster. With the right approach, you can trust your results and move forward with confidence, whatever the outcome may be. When in doubt, test again. Remember, accuracy starts with you. By following the right steps, you're giving yourself the best chance at a clear, reliable answer. Did you recently have a baby, miscarriage, or abortion? Your body might still have HCG in your system. After any pregnancy ends, HCG can linger for weeks, even up to 2 months. A test during this time can show positive, even if you're not pregnant again. This can be confusing and emotional, especially after a loss. The test isn't wrong, it's just picking up leftover hormones. If you get a positive after a recent pregnancy, don't panic. See your doctor for a blood test to check if HCG is rising, new pregnancy, or falling, hormones clearing. Only a doctor can give you a clear answer. Home tests can't tell the whole story. Context matters. Let your body and your doctor guide you. You deserve clarity and support. A chemical pregnancy is an early loss, often before you even know you're pregnant. The embryo implants and starts producing HCG, so you get a positive test. but the pregnancy ends very early, usually before the 5th week. Many women never know it happened. They just get a slightly late, heavier period. If you test early, you might see a positive, then get your period days later. It's real, and it's okay to grieve. Most chemical pregnancies are due to random chromosomal issues. Nothing you did wrong. They're common and don't usually mean you have fertility problems. If it happens repeatedly, talk to your doctor. Your body usually resets on its own. Remember, a chemical pregnancy is a real experience, and your feelings are valid. You're not alone. An ectopic pregnancy is a serious and potentially life-threatening medical emergency. It happens when a fertilized egg, instead of traveling down into the uterus where it's supposed to implant and grow, attaches itself somewhere outside the uterus, most often in one of the fallopian tubes. These tubes are not designed to hold a growing pregnancy, and as the embryo develops, it can cause the tube to stretch, rupture, and bleed. Even though the pregnancy is not in the right place, your body still produces the pregnancy hormone, HCG, so you'll get a positive result on a home pregnancy test. This can be confusing and emotional, because while the test says you're pregnant, the pregnancy cannot continue safely or result in a healthy baby. At first, the symptoms of an ectopic pregnancy can look just like a normal early pregnancy. Missed period, breast tenderness, maybe some mild cramping. But as the pregnancy grows in the wrong place, you might start to notice sharp or stabbing pain, usually on one side of your lower abdomen. Some women experience unusual vaginal bleeding, spotting, or even pain in the shoulder, which can be a sign of internal bleeding irritating the nerves. If the fallopian tube ruptures, it can cause sudden, severe, and life-threatening internal bleeding. This is a true emergency that requires immediate medical attention to save your life. If you suddenly feel dizzy, faint, or experience severe abdominal pain, especially if it's accompanied by shoulder pain or heavy bleeding, don't wait. Go to the emergency room right away. These symptoms can mean there's significant internal bleeding, and every minute counts. To diagnose an ectopic pregnancy, doctors rely on a combination of blood tests to measure your HCG levels and ultrasounds to look for the pregnancy. They'll check if the pregnancy is developing inside the uterus or somewhere else. If your HCG levels are high but the ultrasound doesn't show a pregnancy inside the uterus, that's a major red flag for an ectopic pregnancy. The sooner it's found, the better your chances for a safe recovery. Treatment for ectopic pregnancy must begin right away. Depending on your situation, doctors may use medication to stop the pregnancy from growing, or surgery to remove it and repair any damage. Quick action can save your health and future fertility. If you have a positive pregnancy test and start to feel unusual pain, bleeding, or anything that doesn't feel right, don't ignore it. Reach out to your healthcare provider immediately. Ectopic pregnancies are rare, affecting about 1 to 2% of pregnancies, but they are always serious. With early diagnosis and treatment, most women recover fully and can go on to have healthy pregnancies in the future. Know the warning signs, trust your instincts, and don't hesitate to seek help. Your safety and well-being come first. Acting quickly can make all the difference. A molar pregnancy is a rare and unusual complication of pregnancy, where instead of a healthy embryo developing in the uterus, abnormal tissue begins to grow. This tissue is not a baby, but rather a mass of cells that can look somewhat like a cluster of grapes. Molar pregnancies are also called hydatidiform moles, and they can be very confusing and distressing for those affected, as the early signs often mimic a normal pregnancy. This condition happens when something goes wrong at the moment of fertilization. In a complete molar pregnancy, an empty egg is fertilized by a sperm, and all the genetic material comes from the father. In a partial molar pregnancy, 2 sperm fertilize a single egg, leading to an abnormal set of chromosomes. In both cases, the result is that normal development cannot occur, and instead, this abnormal tissue grows rapidly inside the uterus. One of the first signs may be a very strong positive result on a home pregnancy test. This is because the abnormal tissue produces extremely high levels of the pregnancy hormone HCG, much higher than in a typical pregnancy. Women may notice their symptoms feel more intense than usual, or that something just doesn't feel right. Symptoms of a molar pregnancy can include severe nausea and vomiting, which is often worse than in a normal pregnancy. There may also be unusual vaginal bleeding, which can be dark or watery, and sometimes women may pass tissue that looks like small grape-like cysts. Abdominal pain or pressure is also common, and some women feel extremely tired or unwell. Your doctor may notice that your uterus is larger than expected for how far along you are, or you may have high blood pressure or symptoms related to an overactive thyroid, such as rapid heartbeat or sweating. These signs can be clues that something unusual is happening. Diagnosis is usually made with an ultrasound, which often shows a distinctive snowstorm or cluster of grapes pattern instead of a developing baby. Blood tests to measure HCG levels are also important, as they help confirm the diagnosis and guide treatment. The main treatment for a molar pregnancy is to remove the abnormal tissue from the uterus. This is usually done with a minor surgical procedure called dilation and curettage, or D&C. The procedure is safe and effective, and most women recover quickly. After treatment, careful follow-up is crucial. Doctors will monitor your HCG levels with regular blood tests for several months to make sure all the abnormal tissue is gone and that your body is returning to normal. It's important to attend all follow-up appointments, even if you feel well. In rare cases, some of the tissue can remain and become cancerous, a condition called gestational trophoblastic neoplasia. The good news is that this is highly treatable, especially when caught early, and most women go on to have healthy pregnancies in the future. If you have a positive pregnancy test and experience severe symptoms like heavy bleeding, intense nausea, or unusual pain, contact your doctor right away. Early diagnosis and treatment are key to a full recovery and protecting your health. Some medications, especially fertility drugs with HCG, can cause a false positive. Trigger shots like Ovidrel or Pregnal inject HCG to help with ovulation. If you test too soon after a shot, the test will pick up the medication, not a pregnancy. Wait at least 10-14 days after a trigger shot before testing. Fertility clinics will tell you exactly when to test. Trust their timeline. Other meds rarely cause false positives, but ask your doctor if you're unsure. Always check if your medication could affect results. Don't let a drug mix-up give you false hope or worry. When in doubt, consult your healthcare provider. Knowledge is power. Rarely, health conditions can cause a false positive. Some ovarian cysts produce HCG, and menopause can confuse tests due to similar hormones. UTIs may interfere with test chemistry, causing misleading lines. Certain cancers, like ovarian or choriocarcinoma, can also produce HCG. Kidney disease can affect urine and test results too. If you get repeated positives but aren't pregnant, see your doctor. Persistent, unexplained results are a sign to investigate further. A pregnancy test is a screening tool, not a diagnosis. Your doctor can run blood tests and ultrasounds to find the real cause. Don't ignore confusing results. Your health matters. Sometimes a false positive is your body's way of asking for attention. Listen to it. 7 reasons for a false positive. Some simple, some serious. A home test is just the first step, not the final answer. If your result is confusing or you have symptoms, see your doctor. You deserve clear answers and support. Never feel silly for seeking help. Your health comes first, physically and emotionally. Take care, and remember, you're not alone.